Hi, we are Thet, Emma, Katie, and Matt, and the biotechnology topic that we are going to discuss is pharmacogenomics.
Hi, this is Emma, and I'm going to be introducing pharmacogenomics and also discussing the methods. Pharmacogenomics is the study of genetic variations that influence individual response to drugs. Patients' responses to drugs and susceptibility to certain diseases are often linked to any variations or single nucleotide polymorphisms in their genome. This study can help decrease the events of patients' poor response to drugs and can also help increase the effectiveness of medicines on certain individuals. With the knowledge of patients' genetic variations, prescribers can individualize drug therapy by analyzing their genome and prescribing the correct dosage and type of medicine. Doctors can prescribe the most appropriate medication for their patient using the information made available to them by drug providers on the analysis of the genome. The Pharmacogenetics Research Network holds a conference every year where researchers discuss and share different methods of analyzing genetic data. Although the conference is limited to members of the PGRN, a report is published discussing some of the novel approaches introduced at the conference. This report can serve as a resource for any investigators in the field of pharmacogenomics data analysis.
Hi, this is Matt, and I'm going to discuss how the field of pharmacogenomics has yielded positive results thus far.
To begin with, researchers have discovered a gene that can predict side effects of breast cancer treatment. The use of aromatase inhibitors often causes joint pain that can be prevented. Various cancer drugs have been modified based on the genetic variation of patients. Drugs that have been modified include thiopurine drugs used to treat leukemia, irinotecan used to treat colon cancer, gemcitabine to treat pancreatic cancer, and tamoxifen to treat estrogen receptor positive breast cancer. Additionally, unique antidepressants have been developed for those dealing with psychiatric illnesses such as depression or bipolar disorder. Researchers have gained a better understanding of the genetic manifestation of common diseases such as hypertension. Prescription blood pressure medication has been modified based on levels of renin in the blood. Scientists have also determined that the development of fractures due to low estrogen levels in breast cancer patients could potentially be prevented with prophylactic therapy for osteoporosis.
Hi, this is Katie talking about the pros and cons of pharmacogenomics. Pharmacogenomics will allow doctors to give patients safer and more effective doses of medicine. Eventually, pharmacogenomics will lead to a decrease in price for medicine. By looking at an individual's genome, scientists can discover additional treatment options. Pharmacogenomics can also allow doctors to treat diseases that patients are genetically predisposed to in advance. Pharmacogenomics will make vaccines safer and more effective. On the negative side, initially pharmacogenomics will present an enormous cost to drug producers. Pharmacogenomics calls in the issue of patient confidentiality and presents controversy over racial differences between patients. The initial cost of producing drugs specific to a patient's genome will make these better drugs unavailable to the poor. Finally, the additional drug testing will increase the inhumane treatment of animals in labs.
Hi, this is Seth, and I'm going to discuss our group opinion. Pharmacogenomics may be controversial, but it has its own advantages in the long run. Out of all the people around the world, different people with different ages have diverse lifestyle and backgrounds. Pharmacogenomics can match specific gene variations with responses to particular medications. It offers the promise of predicting whether a medication is likely to help or hurt before taking it. Efficiency is improved, and so the likelihood of treatment is increased while side effects are reduced. Pharmacogenomics will allow the development of custom drugs to diseases such as HIV/AIDS, cancer, and Alzheimer's. Although the technology is still in its early stage, with millions of genetic variations, it might be part of routine medical care in the near future.
Pictured here are the sources that we utilized to investigate the field of pharmacogenomics. Thank you so much for viewing our presentation.